Good afternoon, dear chairs, dear audience. My name is Nina Galdzytska, and I would like to represent to you my PhD topic, that is the role of chronic systemic inflammation in cardiovascular pathology. I am a first-year PhD student and a rheumatologist, medical doctor, and my vision is to improve approaches to the diagnosis and treatment of patients with chronic systemic inflammation. And to achieve this, I have a mission to study inflammatory biomarkers and their role in patients with chronic inflammation. For that, I have two specific goals. Both of them are conducted with the methodology of the systematic review and meta-analysis. So my first project is investigating the role of inflammatory biomarkers in developing severe cardiovascular outcomes in patients with coronary artery disease that we've started on September this year. According to the current knowledge, the inflammation, it plays a crucial role in atherosclerosis and future events like that caused by atherothrombosis. On the picture you can find some biomarkers that actually taking part in this process. So we have a lot of these inflammatory biomarkers like cytokines, chemokines, different immune-related effectors that are immune cells, acute phase proteins, and so on. But these biomarkers evaluation has not been integrated into routine clinical practice for the prediction of cardiovascular outcomes. So therefore, our aim to use this inflammatory as a risk assessment for the future cardiovascular outcomes. Here you can see the approximate list of the biomarkers that we are going to study. It's not full, actually, list, but some of them depends on the recent systematic reviews and meta-analysis. So our clinical question is, do inflammatory biomarkers play a role in the major adverse cardiovascular events in coronary artery disease? For this, we are using the PFO framework, where the P is population. We have two subgroups with chronic and acute coronary heart disease. F, our factor is inflammatory biomarkers, and our outcomes are MACE that include mortality, stroke, revascularization, etc. So our hypothesis, the patient with elevated levels of inflammatory biomarkers have higher risk of these events. Our study is very important because according to these results, we can improve the diagnosis and risk assessment of patients with coronary heart disease. We conduct the systematic search. Here you can see our search key that consists of two domains. First one is basically different biomarkers, and the second one is our population. This is our key articles, 12 of them, because I'm trying to find enough key articles to make a subgroup of different biomarkers to prove that this topic is feasible. And a little bit information about some of my key articles, so you can see the strengths and limitation. And of course, most of the studies, they report just few combination of these different biomarkers. And sometimes, actually, the main problem for us is that even in terms they haven't agreement. For example, in this article, they call the biomarkers as circulating progenitor cells, and that will make it challenging for the selection. This is the flow chart of the selection. So initially we had more than 40,500 articles. After the duplicate removal, we've got 27,000 articles, and now I'm at the stage of the title abstraction. And briefly about my second project, that is investigating the role of inflammatory biomarkers in the development of in-stent restenosis in patients underwent percutaneous coronary intervention. So the background, the same, that PCI is a standard of care for the patient with acute coronary syndrome. It's performed around 900,000 of these procedures per year. It's in the United States. In Hungary, for example, more than 82% of patients with ST elevation coronary syndrome, and more than 54% of patients without ST elevation will be underwent with the PCI. And however, in-stent restenosis accounts in very high percentages, from 7 to 10 after this procedure. So the role of inflammation in this also was clearly demonstrated. On the picture you can see some of the pathways of this process as well. Again, the inflammatory biomarkers and in general inflammation wasn't addressed enough for the risk modification and for the risk assessment of such patients. So our aim to investigate the association between elevation of these inflammatory biomarkers and recurrent restenosis. Our clinical question is, do inflammatory biomarkers increase the risk of restenosis in patients underwent PCI? For this, we used as well the PFO framework, where P, the patients underwent PCI, F, inflammatory biomarkers, and we have two outcomes. The primary is incidence of in-stent restenosis, and secondary, it's MACE. Our hypothesis is the patient with elevated levels of inflammatory biomarkers have high risk of in-stent restenosis after the PCI. The clinical implication of the study could be anti-inflammatory treatment strategies and, of course, monitoring of the patient after this procedure. So to summarize, I have two ongoing projects, and first one I would like to submit till February 2025, and the second one till May of that year. To finish my presentation, I would like with the quote of Theodore Roosevelt: keep your eyes on the stars and your feet on the ground. Thank you very much for your attention.
This is a very hot topic. Has your supervisor shared with you a recent article from Critical Care on this issue?
Not yet.
Well.
Not yet.
So a very, very hot topic, and you know, I'm biased, so everything is revolving around inflammation, everything. But my question is that regarding your second project, giving an anti-inflammatory drug, like loads of them, do we need to prove which biomarkers are released from our immune system, from the cells, in order to define which anti-inflammatory drug should we choose? You know what I mean? So.
I hope so. So basically, I hope I understand your question. So nowadays we are living in the era when we can have the target treatment. So if we will recognize the exact inflammatory biomarkers like interleukins, for example, we can develop specific drug that will target this exact interleukin, and that will help much more than we just trying to decrease inflammation in general. So I would say yes, I think so.
Do you know how many inflammatory biomarkers there are at the moment
At
on
the
market?
moment, more than 250, I guess, and they
least.
developed one by one every month, actually, and the last one, it was discovered on May, interleukin 41, I guess. Yes, it's related mostly to allergy, but who knows? Mm-hmm. Yes, it's just discovered. So yes, it's very broad topic.
Yeah.
But
we could continue with the conversation, but I'm really interested in possibly, John, if you hold the microphone.
Your first study has two populations, one acute and one chronic.
Yes.
What kind of differences do you expect to see between these two populations?
Well, thank you very much for your question. Yes, I would say that it's according to knowledge, nowadays knowledge, we know that in acute situation, of course, inflammatory levels are much higher, and we can detect much more high level of the biomarker circulating, and it's not really understandable clearly what is caused. So the acute process caused the elevation of inflammatory process, or the inflammation lead, yes, growth of the inflammation. So that was one of the aim of our study, to understand the difference between them and maybe to found some solution for that.
Excellent, thank you.
So you mentioned that there are these anti-inflammatory drugs, and you want to find a target. The general, but if you take a general approach and decrease the function of the immune system as a whole, for example, let's, for the sake of argument, let's say steroids, or for a lighter one, NSAIDs. Chronic steroid use also increases both the risk of infection and other complications. So and increase the infection risk, and especially chronic infections increase the risk of atherosclerosis due to an increased local inflammation. So how do you think these anti-inflammatory agents will affect these harmful side effects? So what is your aim?
Thank you very much. So our aim, of course, is to balance these processes, because it's well known that all anti-inflammatory drugs, I mean, the monoclonal antibodies, for example, yes, they have adverse effects as immunosuppression, and the medicine and the strategy in medicine is trying to balance positive and negative effects. So again, in this case, the targeting, I think, will work much better than just prescription of anti-inflammatory drugs in general. So I would say this is the answer.
Thank you.
Thank you for a great presentation, Nina. I have one question about biomarkers. As far as I know, some biomarkers in interleukins work such as anti-inflammation. In your list of biomarkers, I see interleukin-10, which works such as anti-inflammation. My question, will you use all inflammation such as which is increased inflammation in the work such as anti-inflammation in your study, or my question about this, what type of...
Okay. Yeah. Yes, thank you very much. Yes, we will discover and we will study all inflammatory biomarkers. That inflammatory biomarkers include anti and pro-inflammatory. Yes, so we would like to see effect of all of them, plus and minus effects as well. Yes, so thank you.